I'm Dr. Shoaib, and I want to tell you something that most doctors never get the chance to say out loud, because by the time they see the patient, it is already too late. Most people believe a heart attack gives you a warning. A tight chest, a numb arm, maybe a sudden dizziness that sends you rushing to the phone. That is what the movies show. That is what people expect. But the truth I have seen inside operating rooms for more than 2 decades is very different. The most dangerous cardiac events after the age of 60 are not the loud ones. They are the quiet ones. The ones that build while you are lying in bed, while the house is dark, while everyone around you is fast asleep. No warning, no signal, no second chance. And the part that still gets to me, even now, is that these events are almost always connected to something ordinary. Something the person did before they turned off the lamp and closed their eyes. I am Dr. Shoaib, a cardiac surgeon with over 20 years of experience. I have opened chests, repaired arteries, and held human hearts in my hands. I have also spent those same 20 years watching the same preventable patterns walk through my doors again and again, in patients who had no idea, absolutely no idea, what they were quietly doing to their hearts every single night. Tonight, I am going to walk you through 5 of those patterns, 5 evening habits that are loading the gun while you sleep. And then I am going to show you exactly how to unload it, one simple change at a time. What I share with you in the next few minutes could genuinely be the most useful thing you hear this entire year. So stay with me. Here is something that surprises almost everyone when I explain it. Your heart does not get to rest when you fall asleep. It shifts into a different kind of work. In a young, healthy body, nighttime brings what we call a physiological dip. Blood pressure drops 10 to 20%. Heart rate slows down. The arteries gently relax. The entire cardiovascular system runs a kind of quiet maintenance cycle that it has been doing since the day you were born. But once you pass 60, that system becomes less reliable. The blood vessels have stiffened over the years. The pressure regulation is less precise. The hormonal signals that used to protect your heart during those nighttime hours start to fade. The margin for error gets smaller and smaller. Think of it this way. During the day, your cardiovascular system has backup options. It can adjust, compensate, and recover. At night, many of those backup systems are offline. Your body is running on a skeleton crew. That is what makes the nighttime hours genuinely different after 60. That is why research consistently shows that the window between midnight and 6 in the morning carries the highest risk of heart attack and stroke for people in this age group. Not midday, not rush hour. The quiet hours, the dark hours, the hours when no one is watching but your habits are. And here is the part that changes everything. What happens during those dangerous hours is almost entirely shaped by what you did before bed. The meal you ate, the medication you took or forgot, the temperature of your room. Decisions that felt completely routine. That is what we are going to talk about tonight, starting with the one that surprises my patients the most. Let me ask you a simple question. What time did you eat dinner last night, and what was on your plate? I ask every patient that question. And for a remarkable number of Americans over 60, the honest answer is somewhere around 8, 9, sometimes 10 at night. A full plate of food, pasta, fried chicken, a heavy casserole, sometimes a late dessert, followed by the couch, and then bed within an hour or two. I understand completely how it happens. Long days, family schedules, old habits, but from where I sit as a cardiac surgeon, this particular habit is quietly putting enormous stress on a heart that is already working harder than most people realize. When you eat a large meal, your digestive system immediately demands a dramatic increase in blood flow. Your heart has to pump harder to meet that demand. Blood pressure climbs. The fats in your blood, called triglycerides, spike sharply in the 2 to 4 hours after eating. Now take all of that and layer it on top of going to sleep. Your body is expecting the evening to be a gentle wind down, a gradual easing toward rest. Instead, it is facing a full cardiovascular emergency while also trying to shift into overnight recovery mode. Those two demands are pulling in opposite directions. And in a person over 60 who already has some degree of arterial stiffness, that internal conflict is not harmless. Studies have consistently shown that eating within 2 to 3 hours of sleep is linked to elevated blood pressure during the night, higher rates of acid reflux that can closely mimic cardiac symptoms and sometimes actually trigger them, and a measurably increased risk of cardiovascular events during sleep. The solution does not require a complicated diet. It simply requires a clock. Finish your main meal by 6 or 7 in the evening. If you need something later, keep it light. A little protein, some vegetables, nothing heavy or greasy. Your heart is not asking for perfection. It is asking for a few hours to settle before the most vulnerable part of the night begins. Now this next one I need you to hear very carefully, because in my experience is where some of the most preventable damage is happening in people who believe they are already doing the right thing. If you are over 60 and you take medication for high blood pressure, and statistically more than 60% of Americans in that age group do, the timing of when you take that pill matters far more than most doctors ever take the time to explain. Here is why. In most people, blood pressure follows a daily curve. It rises in the morning, peaks through the afternoon, and dips at night. But a significant portion of people over 60, particularly those with hypertension, do not get that nighttime dip. Their pressure either stays elevated through the night or actually surges during the early morning hours, somewhere between 2 and 5 in the morning. This condition has a name. It is called nocturnal hypertension. Most patients have never heard of it, and that silence is dangerous in ways that regular daytime high blood pressure is not. While you are sleeping, your arterial walls are relaxed and not braced for impact. A pressure surge at 3 in the morning hits those walls very differently than a pressure surge at 3 in the afternoon. It is more likely to rupture a vulnerable plaque sitting inside a coronary artery, more likely to trigger clot formation, more likely to send someone to my operating table in the early hours of the morning. If you take your blood pressure medication only in the morning, it may have already worn off by the time you need it most. If you occasionally skip it, you may be leaving yourself completely unprotected during the most dangerous window of the night. What I am asking you to do is simple. Talk to your doctor specifically about timing. Ask whether your medication should be taken in the evening rather than the morning. That conversation takes 2 minutes. There is solid published research, including a major trial called the Hygia chronotherapy trial, showing that taking blood pressure medication at night rather than the morning significantly reduces the risk of heart attack and stroke during sleep. That is not a small tweak. That is a potentially life-changing conversation. And most people over 60 have never once had it with their physician. I want you to think for a moment about someone you know who snores. A husband, a wife, maybe your own mother or father. That loud, irregular rumbling sound in the dark. Most families treat it as a joke, something to complain about, something to nudge your partner over. I treat it as a cardiac warning sign until I have evidence otherwise. I mean that without any exaggeration. Sleep apnea is one of the most underdiagnosed and most underestimated conditions I encounter in patients over 60. Estimates suggest that more than 30% of older adults have some form of it, and the overwhelming majority have never been diagnosed, never been treated, and have no idea what is happening inside their body every single night. Here is what actually occurs during an apnea episode. You stop breathing. It might last 10 seconds. It might last 40. It might happen 30, 40, 50 times in a single hour. Each time, the oxygen level in your blood drops sharply. Your brain reads this as a life-threatening emergency and fires off a stress response. Adrenaline floods the system. Cortisol surges. Heart rate and blood pressure spike suddenly. Your heart is essentially being jolted awake over and over again while the rest of you is still asleep. Night after night, month after month, year after year. Now consider what that does over time. Sleep apnea is directly linked to a 3 times higher risk of heart attack. It is strongly associated with atrial fibrillation, an irregular heart rhythm that itself dramatically raises your risk of stroke. It accelerates the hardening and thickening of arterial walls. And because every single episode happens while the person is unconscious, most people have no idea it is happening until something serious brings them to the hospital. The warning signs are not always as obvious as a loud snore. Some people wake up with headaches they cannot explain. Some feel exhausted even after what they believe was a full night of sleep. Others wake up needing to use the bathroom multiple times, or notice a consistently dry mouth in the morning, or wake with a vague feeling of having choked. If any of those sound familiar, I want you to take it seriously. Ask your doctor about a sleep study. And if you snore heavily, if you are over 60, and if you have any history of heart disease or high blood pressure, getting evaluated is not optional as far as I am concerned. It is part of taking your cardiac health seriously. The treatment, most commonly a CPAP machine, is not the most romantic addition to a bedroom. I know that. But the data on what it does for the heart is genuinely remarkable. People who use CPAP consistently show measurable drops in blood pressure, lower rates of atrial fibrillation, and significantly reduce cardiac risk. One device, used consistently with real and measurable protection. This next habit is driven by logic, and that is exactly what makes it so easy to overlook. A large number of people over 60 deliberately cut back on fluids in the evening. The reason makes complete sense on the surface. They want to sleep through the night without multiple trips to the bathroom. Disrupted sleep is exhausting. Getting up in the dark increases the risk of a fall, so they stop drinking after dinner, sometimes even after 4 in the afternoon. I fully understand the thinking. But from a cardiovascular standpoint, going to bed even mildly dehydrated is a meaningful and largely unrecognized risk factor. When your body is running low on fluids, your blood becomes thicker and more viscous. It does not move as easily through your blood vessels. For a younger cardiovascular system, that is a temporary inconvenience. For someone over 60 with arterial stiffness and any degree of plaque buildup, it is a genuinely different situation. Thick blood moving slowly through already narrowed arteries is significantly more prone to clot formation. And here is the timing problem that most people never consider. During sleep, your heart rate slows naturally. Blood circulation decreases. Your body is lying still for 7 or 8 hours. Now combine that slower circulation with thicker blood, narrowed arteries, and a heart that is working in reduced capacity overnight. That combination, dehydration, reduced heart rate, physical stillness, and vessel disease, is one of the reasons that heart attacks and strokes cluster in the early morning hours in a way that is no coincidence. The fix is so simple, it almost feels too small to matter. Drink 1 full glass of water before you go to bed. Not a large amount, just 8 ounces, enough to keep your blood from thickening unnecessarily while you sleep. Put a second glass on your nightstand. When you wake up thirsty at 2 in the morning, that is your body asking for something your heart also needs. You do not have to choose between protecting your sleep and protecting your heart. Here is the last one, and it is the one that surprises almost every patient I bring it up with, because it genuinely sounds too simple to be meaningful. What temperature is your bedroom at night? Most people have never once thought about it in terms of heart health. They think about comfort. They think about whether they tend to run warm or cold. But there is a specific temperature range that your cardiovascular system works best within during sleep, and drifting outside of that range in either direction puts a quiet and steady extra load on your heart. When your bedroom is too warm, above around 72 degrees Fahrenheit, your body spends the night trying to shed heat. Your blood vessels dilate and stay dilated. Your heart rate stays elevated. Sweating increases fluid loss and brings you right back to the dehydration problem we just discussed. And perhaps most importantly, your sleep quality drops. You spend less time in the deep restorative stages of sleep, the stages where your heart gets its best overnight recovery. On the other end, a bedroom that is genuinely cold, below around 60 or 61 degrees Fahrenheit, creates a different cardiovascular problem. Cold temperatures trigger vasoconstriction, meaning your blood vessels tighten to preserve the body's core heat. Blood pressure climbs. Your heart has to push against more resistance. For someone with existing coronary artery disease or hypertension, that overnight pressure increase is not trivial. The ideal range for sleep and for cardiovascular protection is between 65 and 72 degrees Fahrenheit. That window keeps your body in what physiologists call thermoneutral territory. Vessels are relaxed, heart rate is low and steady, sleep stays deep and restorative. One thermostat setting, adjusted by a few degrees, and your heart spends the night working the way it was meant to. Now I want to bring all of this together, because I am aware that hearing 5 things you may be doing wrong could feel heavy. I want to change that framing completely. What you actually have in front of you is not a list of problems. It is a blueprint. A simple, realistic evening routine that addresses every single one of these risks without turning your life upside down. Let me walk you through how it looks in practice. Between 6 and 7 in the evening, sit down to your main meal. Lean protein, vegetables, a moderate amount of carbohydrate if you need it. A real dinner, just at a reasonable hour. Give your heart 3 to 4 hours to settle before sleep. At 7, take a glass of water. And if your doctor has never specifically talked to you about the timing of your blood pressure medication, make a note right now to ask at your next visit. That single question could be the most important medical conversation you have this year. Between 8 and 9 in the evening, step away from bright screens. Your phone, your tablet, the laptop, The blue light from those screens suppresses the hormones your brain needs to move into genuine sleep, and it keeps your nervous system in a low-grade alert state much longer than it should be before bed. A gentle walk, some reading under a soft lamp, a calm conversation. That is what your cardiovascular system is asking for during this window. By 9, take 90 seconds to prepare your room. Adjust the thermostat to somewhere between 65 and 72 degrees. Set a glass of water on the nightstand. These are not dramatic gestures. They are small acts of genuine protection. By 10, you are in bed. And there is one final detail I want to leave you with that costs absolutely nothing. If you snore, or if you have ever been told you stop breathing during sleep, try sleeping on your side instead of your back. Back sleeping worsens airway obstruction significantly. A simple change in position can meaningfully reduce the number of apnea episodes you experience each night while you work toward getting a formal evaluation. I want to speak plainly with you now, not as someone making a video, but as a surgeon who has been inside that operating room at 3 in the morning. I have held hearts that stopped because a clot formed overnight in an artery that had been narrowing for years. I have talked to families in waiting rooms at dawn, families who had kissed their loved one goodnight a few hours earlier with no sense that anything was wrong. I have read the reports on people who were making plans for their grandchildren the week before they died. And in case after case, the contributing factors were not mysterious. They were a late heavy dinner, a blood pressure pill taken at the wrong time or not at all, a bedroom that was too warm, a body that went to bed quietly running out of water, an airway that had been collapsing silently for years while everyone in the house assumed the snoring was just snoring. These are not rare risks. They are not unusual circumstances. They are the quiet background of millions of ordinary American evenings. And that background, repeated night after night, year after year, can build into a cardiac event that nobody saw coming because nobody knew to look. The truth that 20 years at the operating table has given me is this. Most of the hearts I have had to repair did not fail because of bad luck. They failed because of missing information. Information the patient simply never had access to. You now have it. And the question I want to leave you with is not what you will do next week, or after your next checkup, or when you finally feel motivated enough. The question is what you are going to do tonight. To pull it all together one final time. Finish your main meal by 6 or 7 in the evening. Talk to your doctor about whether your blood pressure medication should be taken at night. Get evaluated for sleep apnea if you snore, wake up exhausted, or stop breathing in your sleep. Drink a glass of water before bed and keep one on your nightstand. And set your bedroom between 65 and 72 degrees Fahrenheit. These are not complicated instructions. They require no special equipment, no expensive supplements, and no dramatic lifestyle overhaul. They require only that you take seriously what is happening inside your body during the hours when you are not paying attention. Your heart has been working for you every minute of every night for your entire life. Give it the conditions it deserves to keep going. And one important note before you close out tonight. Everything I have shared here reflects current cardiovascular research and my own clinical experience. It is general medical information, and it is not a substitute for your own personal medical care. Before making any changes to your medication schedule, please speak with your own physician first. That is not a disclaimer. That is genuine advice from a doctor who wants you watching this channel and taking care of yourself for many years to come. Good night, sleep well, and take care of that heart.